everyone, welcome to my channel. First of all, don't mind how I look. I had horrible allergies yesterday and my eyes are so like red and itchy still, and so I was not able to like put any makeup or anything on, so I kind of look like a wreck. But I just wanted to give an update because I just got back from my maternal-fetal medicine doctor appointment. And I'm sitting in my car. I thought I would just talk about it now so I don't forget what they said, because I know if I get home, I'm not going to remember everything. But, so I had this appointment. I met with a maternal-fetal medicine doctor back in February. And then I tried making another, I have so much anxiety around pregnancy. And so I wanted to make another appointment just to ask a couple questions. Or no, I wanted to message her on the app to ask her a question, and I noticed that she wasn't there, and so I called, and they said that she was no longer with the clinic, and that totally like just freaked me out. I don't know, that's like just like one of my big, I have a lot of big fears when it comes to like having a baby or being pregnant, but one of my fears is like my doctor is just going to like leave in the middle of my pregnancy or something. And I wanted to make sure before I got pregnant that I knew everybody that would already be on my team. I did not want to be pregnant and then for them to say, oh, you need to see an MFM doctor, and then I'm just given a doctor and maybe like our personalities like don't mesh well, or I don't know. I just wanted to know everybody that I was going to be working with. And so when she was no longer there, I wanted to make another appointment and meet one of the current doctors. And so I met with her right now, and I loved her so much. I thought she was just so comforting because I have a lot of anxiety, and reassuring. And so I just kind of wanted to tell you like what we talked about, because being someone who does have type 1 diabetes and is looking into like pregnancy, I feel like I don't know, like I don't know, I feel like I just have so many questions. And so these are the questions I asked and what she said. And this is not medical advice at all. This is not me like telling you to do something or not to do something, or telling you what to do. This is, I'm not a doctor, and this is just personal to me. So if you go to an MFM doctor, it might be different based off of your diabetes or your health or whatever, so many things. And so this is not medical advice at all. I just wanted to kind of let you know what we talked about and what she told me. And so I did get my A1C down from like 6.9 to 6.3, and she was so sweet about it. She's like, oh my gosh, I see that you got your A1C down. Great job. That is so hard to do, and you did such a great job doing it. And she was just like so positive. So I did ask her, to be honest, I flat out asked her, is being pregnant with diabetes just like a disaster? Like, do you just like see pregnant diabetic women in your office and they just come in and it is just a total disaster, horrible idea? Like, I just wanted to be super blunt, because like that's like a worry of mine. Like, it's like I'm gonna be pregnant, it's just gonna be this like total disaster. And she said absolutely not. She's like, we work with a lot of diabetics, every diabetic is different, and we've worked with it for so long, and it's definitely not a disaster. There are different risks that you run, but she said because my A1C is down to 6.3 at the moment, that my risks would not be much higher than just like the general population, which did make me feel better. And then I did ask her, because I do have insulin resistance, and because I've had such awful insulin resistance, it's just caused me to gain so much weight, and I've been trying so hard to lose it. I've been working out every day, trying so hard, and I just, if anything, I feel like I just gain more weight, and it's been very scary for me. And so I just like flat out asked her as well, like, my weight for my height is very high, and that makes me very nervous. Is that like, am I pretty much a given that I'm gonna get like preeclampsia? And she said no. She said like my risk would be about 15% higher. And so that made me feel better. She said obviously having a higher weight does, you know, make you at more risk. She said we would just have you take a baby aspirin every day to make sure, you know, that you're okay, or I don't know, to prevent it. And she said because I don't have any blood pressure issues, and so she did say that that is, you know, a good sign that I don't have blood pressure issues. And she's like, you know, during pregnancy you could develop blood pressure issues, I don't know, but she's like, I've had diabetics who weigh around the same weight as you and they have been fine. And so she's like, no, it's definitely not a given that you're gonna get preeclampsia just because your weight is higher. And she did tell me that I can like still work out when I'm pregnant, as long as you don't try anything like new or like go like horseback riding or something crazy. But she's like, yeah, you can definitely still work out when you're pregnant. You know, she did say obviously it's better to have a lower BMI, but like my BMI doesn't, like, she's like, it's not a guarantee that anything is going to go wrong or be bad or, you know, whatever. And then I had her just look over like my medications and everything to make sure everything was safe. And she was totally fine with it. I'm on an anxiety medicine. And she was okay with that as well, because I asked, I was like, is that like okay to take when you're pregnant? And she said the one that I'm on is fine. And then I did also ask about, I was confused. I'm like, who delivers the baby? I'm like, I know I'm not pregnant yet or anything, but I'm like, do you deliver the baby? Does my gynecologist deliver the baby? Like, who? And she said it just depends. Like, I would be able to choose if I want, what did she say? If I wanted my endocrinologist to work with my diabetes, they could communicate with my gynecologist and my gynecologist could deliver the baby. If I choose to, I can also have my endocrinologist work with my diabetes and communicate with the MFM doctor. Or I could just have the MFM team work with my diabetes and deliver the baby. So she's like, you kind of like choose, like you have 3 different options. And she said, unless it becomes like very high risk that your gynecologist is not comfortable, she's like, then we would for sure deliver the baby. And then you would get to choose if you want your endocrinologist to work on your diabetes or if you want us to work on it. And then I did ask about the insulin drip because it does freak me out. And I said, I'm like aware that this is like so far in the future. I'm not even pregnant yet. But like when I would be in labor, like, am I going to be on an insulin drip? Because I have heard like good things about it. I've heard not good things about it, because then you don't really have control over your insulin as much. Like it's more so like the nurses and the doctor. And she said it would be up to me, but most of her patients do end up going on an insulin drip just because it's so much easier for them when they're in labor, because it's, you know, labor is a lot. And she's like, you know, if you're on an insulin drip, we can manage your numbers better and have better control over it without you having to worry about it as much, because your numbers are going to be going up and down. And then I did mention to her, because I've had I don't know about anybody else, but I have had horrible experiences in hospitals in the past with my diabetes. Like I was always told, like, if your blood sugar is super high and you can't get it down, go to the emergency room. And there was one day, well, it actually happened twice, but there was one day in particular, this was a couple of years ago, but my blood sugar was in the 600s for hours and I could not get it down. And eventually I was like, okay, I'm gonna go to the emergency room because I don't know what to do. And so I went to the emergency room and they literally hooked me up to an IV and I sat in a room by myself for hours, for like 5 hours. And we just like waited for my blood sugar to go down. I was like, okay, I could have just stayed at home if this is like all that was gonna happen. Like, I don't know what I was expecting to happen, but like being like put in like a back room and being left by myself to worry about my blood sugar and have nobody really do anything was like not it. And so that was a horrible experience. And then I went to the emergency room for the same thing a couple of years ago as well. And this was horrible. I was telling the MFM doctor this, because it's like my biggest fear. Like, what if I go into labor? And it's like, I feel like when I go to the emergency room, like, no one has ever heard of diabetes before. Like, I feel like nobody knows what to do. And I'm like, why did I even come here? And it's like, I'm like, I don't want that to happen when I'm in labor. Like, the people to be like, oh, you don't know, oh, it's a pregnant diabetic woman. Like, what do we do? Like, we don't know how to manage the diabetes. Because one time I went to the emergency room for high blood sugar again, and they didn't know what to do. And I told the MFM doctor this, and she was like horrified. But the nurses and doctor went to a different floor, like a different department, got the receptionist from somewhere else, and the only reason they got her is because her son has type 1 diabetes. And so all of a sudden this receptionist walks into the room, and she's like, so I'm not a doctor, but they wanted me to come in here and talk to you because my son has type 1 diabetes. It was horrified. And I was like, I'm never coming to another emergency room again for high blood sugar, because like, what in the world? That's crazy. That would be like somebody like bringing me into the emergency room for a patient who has high blood sugar and being like, oh, can you help her because you're a diabetic? No, I'm not a doctor. I don't know what to do. Like they grabbed her just because her son is a type 1 diabetic. And I was like, I do not want that experience when I'm in labor. And I'm already scared. I'm already vulnerable. I'm already like a wreck. You know, my husband is nervous. I'm going to be nervous. And then I don't want the experience of like nobody knowing how to deal with my diabetes. And my MFM doctor was baffled by that story and said, no, that's not how it will be here. She's like, we've worked with many women with type 1 diabetes, type 2 diabetes. She's like, you would be in great hands here. And so that definitely made me feel better, because that has been on my mind a lot. Like, I just don't want that to happen. Like, it's like one thing for it to happen when you're like, your blood sugar is high and you're just scared, but it's like another thing. Like, I can't imagine like going into labor and then going to the hospital and like nobody knowing how to like deal with me. But so anyway, also sorry, I apologize for the camera being this way. I think it's probably gonna look weird on my video, but I had to prop it up in my car and I couldn't get my phone to sit horizontally. But that's all I wanted to say. I don't know if this video is helpful for anybody. I always am looking for videos of just people's experiences before and during and after pregnancy, because like I feel like I just don't see it that much. And so I just kind of wanted to like walk you through like how my personal appointment went. But yeah, comment below if you have any experience with a maternal-fetal medicine doctor, or like, you know, if they've given you like those 3 choices of whether you would have your OBGYN deliver and work with your endocrinologist, or if you have the maternal-fetal medicine team do your diabetes and deliver, or if you've had your endocrinologist kind of work with your maternal-fetal medicine team. I feel like that would probably be the best. But let me know if anyone has like been given those options and like what they chose, and if you thought your choice was good, because like I'm like, I don't know. I liked the maternal-fetal medicine doctor. I like my OBGYN. I'm not crazy about my endocrinologist, but I do like the pharmacy technician that works there. She's actually the one that's been able to help me get my A1C down to 6.3 so quickly. And so I wouldn't mind like her communicating with them. I mean, my endocrinologist seems, I don't know, he doesn't do a whole lot, I feel like, but she is on top of everything. So yeah, let me know if you were given those options, what option you chose, and if, you know, you would recommend, you know, if you would make that choice again. But anyway, all right, thank you so much for watching. Bye.